Okay. My presentation is called Access to Care. Here we go. Overdoses are the leading cause of death among adults ages 18 to 45. According to the U.S. Center for Disease Control, there were over 100,000 overdose deaths in just the year 2023. Fentanyl is responsible for nearly 70% of all overdose deaths. Appropriate care for those suffering is necessary for recovery, and it's also necessary for staying alive. Too often, people are turned away or sent to lower levels of care due to issues with insurance coverage. For my credibility on this topic, my family has struggled with addiction. I've witnessed multiple overdoses, treatment centers, and detoxes. Thankfully, they are all in long-term recovery due to being able to get adequate care. My mother also works in the field as a licensed drug and alcohol counselor. On multiple occasions, she has shared with me that she has had to discharge people or put them in lower levels of care due to insurance companies not cooperating. Allowing individuals to get appropriate care immediately could help stop the revolving door of treatment centers, hospitals, and jails many addicts face. When people are only allowed outpatient programs, short-term inpatient programs, and limited therapy, the issues they are facing cannot be completely worked through, and this causes relapse, crisis, and death. Something else I would like to add that I didn't put in my presentation is even with the recommendations of these providers of licensed drug and alcohol counselors, peoples with master's and bachelor's degree, insurance providers are not cooperating or following through with the recommendations, and they will cover maybe only 30 days of treatment when the recommendation was 90 days of treatment and then sober living after and continued outpatient and things like that. And that causes people to relapse. There's some benefits of insurance providers covering more care. Long-term treatment is not cheap and will cost insurance companies more money upfront. But with that being said, covering long-term appropriate care will save insurance companies money in the long run. By providing the right care, insurance companies reduce the risk of relapse and hospitalizations and all other expensive consequences that come with substance use disorder, whether that be, issues with health that they're going to have to pay for later on or things like that. Private versus public insurance. So government funded insurance or public insurance is much keener to cover mental health and substance use treatments. Unfortunately, many people don't qualify for public insurance, and we don't have, we don't have free health insurance for all, which that's another argument for another time. But this forces people to acquire private insurance. Appropriate and adequate care is a right for all. The stigma. So there's a large stigma around addiction, though I think we are heading in the right direction. Still, a lot of people believe the reason behind the lack of coverage is due to the stigma surrounding addiction. The DSM-5 classifies addiction as a disorder of the brain, and it should be treated and cared for as such. Oh my goodness. Some supporting evidence that I found, the National Alliance on Mental Illness seems to support this theory, stating focused excessively on treating and addressing acute symptoms and stabilizing crisis while ignoring effective treatment of underlying conditions. Another article I found, Miriam Bendat is a lawyer leading a lawsuit against United Healthcare, and she states insurance companies can easily circumvent mental health parity mandates by imposing restrictive standards of medical necessity. So there was a bill passed or a law passed to make private insurance providers cover more mental health stuff, but they have figured out a way to work around that. So basically it helped a little, but it did not help enough. And then here's just a list of my references. And yeah, that's all I have. Thank you for listening.